Justin Parkhurst. I work at the London School of Hygiene and Tropical Medicine, and I'm linked in with the Evidence for Action Research Consortium.
And what were you presenting at the meeting?
Yesterday I was presenting a brief overview of a piece of research we're doing that specifically tries to understand the process by which research evidence gets taken up. Specifically, it was looking at one drug for HIV treatment known as cotrimoxazole, and how that drug has been taken up and put into practice in 3 different African countries. The piece of research is trying to understand why and what factors influence how quickly research evidence, and in this case, a single body of research evidence, gets taken up, and why in some countries we see it happening more rapidly than in others.
So what were the main things that came out of your piece of research?
Well, the primary findings were that, of course, as we expected, every context would be different. Certainly the way that the research was understood in countries, in one of our countries, was actually very important. Many times, research evidence from a medical piece of research regarding clinical treatments is not often taken up in the policy sphere. We found in one case, for example, that it was the fact that the evidence was simply conceptualized as a clinician's decision, as basically a physician's decision, clinical choice, meant it didn't get taken up in policy. However, a lot of treatment on the ground was being provided by non-physicians. It was lower levels, lower cadres of health workers who were being brought in to provide services, but needed more policy guidelines in order to do so. So simply the fact that the evidence was conceptualized in one way affected whether or not it was taken up in policy. And of course, in most cases, we also found the importance of having a key policy actor, a key policy champion, to push forward that piece of research on the agenda, who's networked into the right people and is there at the right point in time when policy change is going on. So this combination of factors, having the correct evidence conceptualized in the right way, having a key individual or a key group of individuals who can put it on the agenda, and then to have the process going on where there's a window of opportunity when that policy change can happen, those sorts of factors.